and communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable.
That was the Surgeon General of the United States, Jerome Adams, at Friday's White House coronavirus briefing, discussing something we've talked about on this show for weeks now, how COVID-19 cases and deaths will disproportionately affect communities of color, due in part to long-established health disparities in this country. Here in New York City, the epicenter of the virus globally, early data shows coronavirus is killing African Americans and Latinos at twice the rate of white residents. This is what one local emergency room doctor hopes comes from all of this.
I fear that those who have died during this pandemic will die as martyrs, but I hope that their deaths will actually lead to fundamental change and hopefully a gross overhaul of our U.S. healthcare system. A system where everyone has equal access to care and the same level of care, no matter the color of their skin, the size of their wallet, their legal status, or whether they've been incarcerated or not.
Joining me now, Reverend William Barber, Reverend Dr. William Barber. He's the president of the Repairers of the Breach and the co-chair of the Poor People's Campaign. Nicole Hannah-Jones, award-winning journalist for the New York Times, lead on the 1619 Project and co-founder of the Ida B. Wells Society. Back with us, Professor Eddie Glaude, chairman of the Center for African American Studies at Princeton University and an MSNBC contributor. Welcome to all of you. Thank you for joining me for this very important issue. Nicole, one of the remarkable things about the project that you're working on, the 1619 Project, when the first Africans were brought to American shores against their will, is that there has been disparity, some of which goes back generations, that have set in to cause the things that are causing African Americans to contract and die from coronavirus at a higher rate. And some of this is historical and will need massive change to fix.
Yeah, for sure. I mean, if you look at the conditions that large numbers of Black Americans live in, it's not surprising that Black Americans are bearing the brunt of this coronavirus. When you look at Black Americans remain the most segregated group of people in this country, the most likely to live in areas with lots of pollutants and toxins in the environment, live in areas that don't have access to level 1 trauma centers. They're the most likely to be working in the service sector, public-facing jobs, least likely to cars, most likely to take public transit. So all ways that this virus was spread, and on top of that, living in high conditions without access to quality health care, that Americans were more likely to get the virus, and then, of course, have been more likely to die from it.
Reverend Dr. Barber, you and other African-American pastors are meeting this week to discuss how some of these inequalities can be fixed. Are you looking at this from the perspective of the coronavirus emergency, or generally speaking, how health inequality can be fixed? Because we could be talking about coronavirus, we could be talking about heart disease, we could be talking about diabetes, we could be talking about a lot of things that affect people of color in this country differently than they affect the general population.
Well, we as pastors are going to have a press conference and make some demands, because you could talk about what's happening right now, you could talk about what's been happening, and one of the great failures of what the Surgeon General said was when he tried to suggest some things about personal responsibility and would take no responsibility for the systemic realities that are happening, many of which the Trump and Pence administration and Republicans and others have helped perpetuate. You see, the issue is not race, it's the immoral legacy and a reality of systematic racism that's causing so many African Americans to die disproportionately. The United States has all of these open wounds rooted in decades of racist policies and the criminalization of poverty. And the coronavirus is revealing that. You know, think about it. Every southern state where you've had racist voter suppression, those who get in office because of racist voter suppression have denied just basic Medicaid expansion. They've denied it to millions of people, and that disproportionately affects African Americans. And we know from studies from the Institute of Medicine that African Americans have less access to affordable, high-quality health care and often receive lower quality care than their white counterparts. Those are realities.
Eddie, to the degree that this is actually who we are as a society, these statistics don't surprise you at all.
Not at all. And in fact, when we call attention to this deep structural reality that makes particular populations, particularly black folk and brown folk, vulnerable. You get a kind of ideological response, right? A response that has in some ways been cultivated for the last 40, 50 years, but has in some ways been a part of our country's discourse since its founding. And that is that our condition is a result of some choice that we made. This is to echo Reverend Barber's critique of the Surgeon General. So yesterday I made a basic point about our population being disproportionately vulnerable to the effects of the disease, of the virus. And I was overwhelmed. Tucker Carlson last night on Fox News talking about that we call the coronavirus racist, that we were engaged in victimology again. What we see here is a reluctance on the part of the country to actually confront the suffering that black communities are experiencing, that brown communities are experiencing, because to confront that suffering is to confront their implication in it. And so part of what we have to do is to try to not only call attention to the reality, but we have to deal with this discursive environment, this ideology that has framed how a large percentage of Americans understand black suffering, how they process the suffering of people of color. We have to try to change that at its root.
Nicole, let's just take a look at New York City and coronavirus by an economic divide. In zip code with the highest positive cases, the highest number of positive cases, annual income is $26,708. In zip codes with the lowest positive cases, annual income is $118,000. If you look at Milwaukee, if you look at Detroit, if you look at Chicago, and if you look at Philadelphia, African Americans make up similar proportions of those populations, but their rate of death is 3 to 4 times proportionate to their representation in the population.
Yeah, and I want to piggyback a little bit on what Eddie Glaude said, which is just look at how the rhetoric around this virus has changed now that we know lots of black people are dying from it. No one was talking about personal responsibility when we thought this was a virus that was hitting all communities the same. We only start to see that when we see that it is black people who are dying. When you look at in New York, so for instance, I started working from home about a week and a half to 2 weeks before the entire city was locked down, because I work the type of job where I can work from home. When we look where this virus is hitting the most deadly, it is communities that don't have the luxury to work from home. It is the people who, as you so beautifully pointed out in your opening montage, the people who we see as the service sector, who make sure that our city runs, who are driving the buses every day, who are delivering our mail, who are the cashiers at the grocery stores. They could not work from home. And on top of that, they were already dealing with grave inequalities before this virus hit. They were already living in under-resourced communities. I think the most kind of fascinating thing is we thought that this was a virus that only killed older people until it came to the United States. And then we see that black Americans go through what is called weathering. Black life here is so difficult that black people age more quickly. We start to get those comorbidities, diabetes, hypertension earlier than other groups. And so it started killing Americans at younger ages. We have to deal with these fundamental inequalities that have been laid bare by this epidemic, but we're always here.
Black people in America have similar underlying conditions to elderly people in Western European nations, like diabetes and like heart disease. Reverend Dr. Barber, to Nicole's point, yesterday at the press conference, the daily press briefing, the president, the Surgeon General, and the vice president all did talk about personal responsibility. It seemed to be in the context of people of color, that you need to take better care of yourselves, and then you won't have the same exposure to this illness.
Well, that's an old argument. It's been made for years and years and years, when people, particularly who have participated in passing policies that disproportionately hurt African Americans, then they turn around and try to suggest it's a matter of personal responsibility. And that is why we must challenge it so hard. And that was why it was so ugly for the Surgeon General to do that, and to be black, and then to try to use having a call with the NAACP to make that point. You know, we need a real rescue bill. We've had a rescue bill for the wealth and corporation, but we've not had a rescue bill for the poor. Therefore, we've abandoned millions of African Americans and white people in Appalachia. But let me drill down on this African American piece. For instance, in Mississippi, 52% of people in Mississippi are poor and low wealth. but over 67% of people of color in Mississippi are poor and low wealth. 300,000 people in Mississippi are uninsured, and Mississippi has refused to even pass the Affordable Care Act. So when you pass a bill and give $2 trillion to corporations, but you pass a bill and you refuse to provide health care for the uninsured, refuse to pay sick leave, no national rent moratorium, no help to pay those rents after this, no internet for children, no moratorium on water shutoff, then what in fact you are doing is you are exacerbating the inequities and the fissures that already exist in our society, which is why we must have a rescue bill for all people and a rescue bill that drills down to deal with the poor. Otherwise, we're still in trouble as a nation.
Thank you to the three of you for shining a light on this important issue. Reverend Dr. William Barber, Nicole Hannah-Jones, make sure you follow her on Twitter and read her remarkable work. And Eddie Glaude, as always, thank you, my friend.